From groundbreaking medical discoveries to the best mental health practices, here on Health Watch, we'll look at the latest health topics that impact you and your family's well-being. Hello, I'm Stephanie Stahl, and coming up, Philadelphia District Attorney Larry Krasner aims to lower the price of insulin in a new lawsuit he filed on Monday, and later see how a neurosurgeon used a guitar to help remove a tumor. Let's get started.
A lawsuit filed by the Philadelphia District Attorney is aiming to lower the price of insulin. Health reporter Stephanie Stahl was there.
You know, millions of Americans have diabetes, including about 14% of adults here in Philadelphia. And while there's been a lot of action to lower insulin prices, the DA says it's not enough.
This is a story about profits over patients. This is a story about price fixing.
For District Attorney Larry Krasner, it's personal, the skyrocketing cost of insulin used by millions of diabetics.
So I am a diabetic. I was diagnosed about 15 years ago.
Krasner is filing a lawsuit against nearly 20 pharmaceutical companies and pharmacy benefit managers for colluding to inflate the price of insulin that's used to control blood sugar levels.
My life and well-being depend on uninterrupted access to insulin.
Jesse Braxton, a Philadelphia high school teacher, was diagnosed with type 1 diabetes at age 5.
The cost to produce a vial of insulin is between $3 and $6. Yet last year, the out-of-pocket cost for a vial of insulin, which is enough to last about 3 weeks for me, was nearly $300.
Insulin prices vary depending on different insurance plans. For people who don't have coverage, it can be catastrophic. And even for people with insurance, like the DA, there can be challenges and glitches.
And all of a sudden, I have a pharmacist telling me that continuous glucose meter that you wear will be $997 for the month. Rather than $12.
The new lawsuit comes as Medicare, some states and manufacturers have dropped insulin prices, but it's not uniform. And there's frustration with pharmaceutical companies expressed by Philadelphia nurse Maureen May.
It's obscene, the profits that are made. People need insulin to live. Why profiteering is allowed, I have no idea.
Now, the drug makers and pharmacies named in the lawsuit say it is baseless, and some we contacted, we asked for a comment, said they have already lowered prices on insulin and have a variety of programs to help patients with costs. So lots of moving parts on insulin.
Ooh,
of course, we'll keep you posted on how this rolls out.
Stephanie, thank you so much for that. An abortion case that could affect women across the country is being considered by the Supreme Court.
Their decision could affect the availability of the so-called abortion pill, mifepristone. But as health reporter Stephanie Stahl explains, there are indications access may not be impacted.
Hundreds on both sides demonstrated outside the U.S. Supreme Court on Tuesday during arguments on access to the abortion drug mifepristone. In 2016, the FDA extended the window women can take mifepristone from 7 to 10 weeks, and during the pandemic in 2021, it said in-person doctor visits was not needed, allowing mail-order pharmacies to ship the drug nationwide.
It's particularly appalling if the FDA based its 2021 decision to remove that in-person visit on studies it acknowledged were, quote, not adequate.
But FDA's ultimate conclusion was that mifepristone could safely be dispensed without in-person visits. It had voluminous evidence, I think, to support that conclusion in 2021, and there's been no contrary evidence that's been introduced.
The ruling would impact all states, even those where abortion is legal.
The number one premise for me is that chemicals should never be used to take innocent life.
Catherine Colbert argued for Planned Parenthood in a previous Supreme Court case. What would the impact be in states in the Philadelphia tri-state area, which would be Pennsylvania, New Jersey, and Delaware?
The regs require a woman to actually go into a doctor's office and collect the pill directly from the doctor. The mailing of drugs, the getting of drugs from other sources within a state would be unavailable.
During questioning, both conservative and liberal justices appeared to side with the FDA, asking whether the anti-abortion advocates had the legal right or standing to sue. A decision is expected in June. Stephanie Stahl, CBS News, Philadelphia.
Well, the first birth control pill available in the U.S. without a prescription, it is officially on sale now.
It is a major milestone in access to contraception in the U.S. The company that makes the oral contraceptive Opill started making it available for purchase at opill.com and on Amazon. A 1-month supply costs about $20. A 6-month supply sells for $90. In some cases, insurance may cover that cost. Doctors say the sale of this drug online is a game changer for women who lack access to health care.
So in the past, you had to go see your doctor to be able to get the prescription for contraception. And we all know that sometimes that's just not easy. So sometimes women live far away, takes a while to get an appointment, maybe don't have health insurance right now. And so this gives you a safe and effective option.
Drug maker Perrigo recently started shipping Opill to CVS and Walgreens stores as well. The FDA says the drug is generally safe for most individuals and it's about 93% effective. There are some warnings, however. Opill should not be used as an emergency contraceptive, and patients with breast cancer should not consume it.
Meet a surgeon who's also running a farm in Upper Bucks County that's helping cancer patients recover.
That's right. Health reporter Stephanie Stahl was on the farm today to see how it works.
Up on the farm, and it was a beautiful day to be up there. A little windy, but sunny and nice. Well, it is a 40-acre farm that's called a living laboratory for cancer patients, all about finding wellness in nature. And it is the brainchild of a doctor with a special mission.
I'm a city girl. I grew up in Mount Airy. We didn't learn the lessons of gardening and nutrition and even herbal medicine. And it's been an experience and a journey.
And what a journey it's been for Monique Gary, who runs and owns Still Rise Farm in Percy.
I literally have a brown thumb, but I'm not letting it stop me.
She's used to breaking barriers. Dr. Mo, as she's known, is a breast surgeon and medical director of the Grandview Health's cancer program.
But I think it is breaking some barriers when you look at the fact that less than 2% of all oncologists are people of color. And then when you look at farming, you know, farming has historically excluded black folks.
For her, it's about inclusion, including nature as being a critical part of wellness. Her farm is where patients come to be part of nature.
We call it experiential learning. It's like an incubator farm where folks come out and they're going to get a chance to really experience for themselves different facets of wellness.
And then in here will go mushroom soil, which is very organic and rich.
70-year-old Mona Gold was diagnosed with breast cancer almost 3 years ago. She says working on the farm has been an important part of her recovery.
Anytime I get to be in the garden and outside, it makes me feel good and healthy.
And this pond is fully stocked with fish.
There's fish in there.
There are fish in here. It's about an acre and a half, almost 2 acres.
Dr. Mo says the 40-acre farm is about to explode with its spring and summer bounties.
We grow our blueberries, our raspberries, our blackberries, and there are medicinal properties in those. There are antioxidant properties that get rid of damaged cells. Green leafy vegetables, our dark green leafy like spinach, kale, and chard. Those are things that can help increase trace minerals in the body, and they can help promote healing as well.
From the operating room to the farm, Dr. Mo is all about building a healthy community. And there are a number of special events coming up at Still Rise Farm. We have a lot more information for you at cbsphiladelphia.com. She is an impressive lady, and that farm is beautiful. I can see why patients go there and just feel so much better.
Oh, without a doubt. I was feeling the same way just watching that. That's fantastic.
Exactly.
Good stuff. Thank you, Stephanie. A celebration was held for the opening of a new Veterans Affairs Research and Rehabilitation Center.
Today we're celebrating the investment of the VA healthcare system in research and translation to bring new technologies to our veterans.
When the VA does what it does, research and development, that benefits our veterans, guess what? It benefits our loved ones, the caregivers, our families, because this might mean somebody who wasn't going to be able to get up and go because they were in so much pain might get to go to a friend's wedding.
The VA Rehab Create Motion Center will conduct research in cartilage regeneration to restore joint function and transform the long-term health of veterans, many of whom suffer from joint disease. Now, the bridge collapse in Baltimore has sparked renewed fears that some people have about crossing bridges.
Health reporter Stephanie Stahl joins us with more on the phobia and an escort on one local bridge.
That's right. We found that for you guys. You know, just like some people have a fear of being in a closed space, claustrophobia, doctors say being afraid to cross a bridge might be irrational, but it's still very real.
My fears have just gotten worse. Just looking at that bridge gives me anxiety.
TikTok is filled with people talking about fears of going over large spans.
Over that bridge will give you a nosebleed because you're so high up in the air.
Technically, it's called gyrophoria, an inordinate fear of bridges, especially crossing bridges. Mix that with agoraphobia, the fear of heights, and crossing big bridges can be a terrifying experience for some. For people who are fearful, the Delaware River and Bay Authority has a special escort program. You call ahead and meet on the side of the road before crossing the bridge. So you talk to people and try to ease their fears as you're driving?
We do. Yeah, it's always better to keep the conversation going, and that distracts them from, their fear.
Sergeant Steve Burkhead with the Delaware River Authority showed us how it works.
It's a cool part of our job because it's a casual conversation we get to have with the public.
He's in the driver's seat of our car going across the Delaware Memorial Bridge.
I usually tell people to just focus on the road. It's the same road in front of you as you get out back on the highway once you cross the bridge. So just focus on the road and you'll be okay.
He says people have all kinds of explanations for their fears. And while most people are fine, the officers never know who they're dealing with.
Yeah, it's a little dangerous, but we do it. Just because we don't know what we're walking into. We're definitely cautious of that, and we kind of have to read the body language a little bit.
And now they're expecting to get more requests for escorts after the bridge collapse in Baltimore. And doctors say most people are able to cope with their fear of bridges without extra help by slowing down. Some even roll down windows just in case they end up in the water in their car. We have a lot more information on the Delaware Bridge Escort Service, CBSPhiladelphia.com, and that is a service that is for free. The sergeant told us you should hear the stories that people have about their fear, that he gets to know them as they're crossing the bridge.
It's a thing. It's a real thing.
But it's a nice thing that they do there.
Indeed. That's great.
It's truly fascinating.
It is.
Thank you so much, Stephanie.
Thanks, Steph. Appreciate it.
Well, we all know about the harmful effects plastic pollution can have on the environment, but a new study reveals a surprising number of toxic chemicals in plastics could be hazardous to our health. CBS's Tina Kraus reports from London.
In a world craving convenience, the prevalence of plastic is unprecedented, and a new report reveals the hidden dangers lurking inside.
These materials, they look really shiny and nice and colorful and simple, but chemically they're quite complex.
European scientists compiled a list of over 16,000 chemicals found in plastic products, at least 3,000 more than international environment agencies had estimated. Researchers discovered more than 4,000 of the chemicals are toxic, not only to the environment, but to our health.
The point is that these chemicals can leach from the product into the food, so from packaging into food. And when that leaching happens, people ingest these chemicals with their food.
Toxicologists say hundreds or even thousands of chemicals can be found in a single plastic product, from food packaging to children's toys to medical devices.
These are materials that have been in use for 60, 70 years. They power our economy. They enable a lot of successful business models, but they come with a high price tag.
While some countries, including the U.S., regulate chemicals used in plastic, other nations don't.
In order to robustly solve plastic pollution, you actually have to look at the full life cycle of plastics, and you have to address the chemicals issue.
Another push for progress as global plastic pollution mounts, with about 400 million tons piling up every year. Tina Kraus, CBS News, London.
The Environmental Protection Agency has finalized a comprehensive ban on asbestos, a carcinogen that is still used in some products. Asbestos kills tens of thousands of Americans every year. A form of it is still used in chlorine bleach, brake pads, and other products. The administrator of the EPA, Michael Reagan, called the ban a major step to protect public health. Researchers at the University of South Carolina have discovered that statins, normally used to lower cholesterol, can also be used to improve gum health. The researchers found that statins can lower inflammation from periodontal disease. Scientists say the drug treatments may one day replace invasive procedures like surgery to treat gum disease. New study says you should reduce your exposure to bright light outdoors. Researchers in China found that excessive exposure to artificial lights at nighttime could be a potential risk to brain health, and that excess exposure could even lead to stroke. The researchers advise people living in urban areas to limit their exposure as much as possible.
A popular sexual enhancement drug might become a new treatment for Alzheimer's disease.
Health reporter Stephanie Stahl joins us to explain this interesting new research.
That's right, guys. This is a drug that started out as a blood pressure medication. And for a number of years now, researchers have been investigating its ability to also help with Alzheimer's. Viagra to treat erectile dysfunction was revolutionary for millions of men. Now there's more research showing the little blue pill might also be helpful for treating Alzheimer's disease. It's estimated 6.7 million Americans over the age of 65 are now living with the brain-robbing disease, a number projected to grow nearly 13 million by 2050.
I will not sugarcoat it. There are hard days. It's one day at a time. Just do the best that you can.
Treatments currently available for Alzheimer's are limited. The new research from Cleveland Clinic showed Viagra reduced Alzheimer's prevalence by 30 to 54% for patients who took it compared to those who didn't. Scientists say Viagra appears to lower levels of certain proteins in the brain linked to Alzheimer's. Results also indicate boosted cell growth, brain function, and reduced inflammation. Those results are based on computer models analyzing insurance claims and brain cells in Alzheimer's patients. To prove it really does work, it needs to be tested on patients.
I think the next step we really work on together with our colleague, physician here, is to try to conduct the clinical trial.
The researchers have been studying the possibility of repurposing Viagra for Alzheimer's for 3 years now. And while researchers are hopeful, doctors say people should not be taking Viagra for Alzheimer's until there's proof it works.
Here's another reason to get a good night's sleep. Not getting enough shut-eye can make you feel older. That's according to a study published in the journal Proceedings of the Royal Society B. Researchers found that not getting enough sleep can make you feel 5 to 10 years older than you really are. They say that's because a lack of energy and motivation makes people feel older. It also limits physical and social activity, two things that can help you feel younger.
Playing a guitar while having brain surgery sounds a little wild, right? But for one young musician, it helped guide the surgeons.
Health reporter Stephanie Stahl joins us to explain how it works.
Amazing.
It's really wild, guys. Now, brain surgery is always a delicate procedure, and doctors say sometimes it needs to be done while the patient is awake. It's a different kind of way to play guitar for 24-year-old Christian Nolan. It's happening during brain surgery to remove an aggressive tumor.
It was mainly like pressure. I could feel things moving, but no pain or anything.
The tumor was located in a delicate part of the brain that can affect hand movements.
We performed his surgery awake so that we could be able to remove the tumor safely and be sure that we weren't harming his hand function.
Neurosurgeons say when a patient is awake during a craniotomy, it requires less bone removal. It can also limit injury to surrounding brain tissue.
If you don't have the ability to do the surgery awake, this operation becomes actually much riskier.
The procedure lasted about 2.5 hours. Nolan was only awake for part of it as his team of doctors monitored the use of his left hand.
The patient is completely comfortable during the awake part of the surgery. They do not feel any pain, and they do not remember most of the procedure.
Nolan remembers someone handing him the guitar, amazed to be playing during brain surgery.
I just can't believe that was me.
Nolan still has to undergo treatment, including chemotherapy, but the tumor was completely removed. And doctors say Nolan was fortunate the tumor was caught early before it caused any permanent damage. And during the surgery, he was also entertaining the doctors with little guitar work, right?
Wow.
Helping them focus.
That's incredible. That's incredible.
Yeah.
Thanks, Steph. Appreciate it.
The virtual universe is expanding even now in our post-COVID world.
Let's look into virtual nursing with health reporter Stephanie Stahl.
That's right. It's still the big thing, guys. A growing number of hospitals are using virtual nurses to help reduce burnout and turnover. After 4 deployments as an Air Force nurse and more than 20 years on the job, Teresa Jackson needed a change.
How are you doing? How are you feeling?
She traded scrubs for a screen and now works as a virtual nurse.
It doesn't require you doing a 12-hour shift. It doesn't require you giving shots or passing out pills.
The new role helped her combat burnout.
It was essential for my mental health to find a way to still use my expertise after I left the military.
A recent survey finds burnout for physicians and nurses remain above pre-pandemic levels, with staffing shortages noted as a key contributing factor, along with too many bureaucratic tasks.
Virtual nurses have taken off significant administrative burden to our floor nurses.
Virtual nurses generally focus on areas such as patient outreach and education, admissions and discharge instructions, allowing their counterparts to be more hands-on at the bedside.
I'd say anywhere from an hour to 90 minutes, an hour and a half, it's given back to that floor nurse. It could save a life, and it can also save a nurse from turnover.
My health 24 hours, things have changed. Right?
Patient Janelle Jackson, experiencing a virtual nurse for the first time during her hospital stay, appreciated the extra attention.
The regular nurses may not always be able to get to you.
How did you feel you walking around? And how
innovation improving outcomes for all sides. Now, some virtual nurses work remotely from a call center, and a few hospitals are now experimenting with them working from home, all in effort to help the nurses at the bedside who are really often overwhelmed with patients.
No doubt about that. That's for sure. Steph, thanks so much. Appreciate it. Well, researchers are testing a new way to treat depression.
Health reporter Stephanie Stahl joins us with more on some very hopeful patients.
They are hopeful indeed, Siafa. You know, millions of Americans suffer with depression, and while treatment is helpful for most, some don't respond. And for those most severe cases, doctors are experimenting with a pacemaker for the brain. Emily Hollenbach suffers from severe depression that often left her barely able to move.
My family has a very long history with mental illness and depression specifically. My parents actually both took their lives before I was 30.
Hollenbach tried everything from medication to electroconvulsive therapy before having electrodes implanted in her brain.
At first I was blown away because the concept of it seemed so just intense, like it's brain surgery.
Now she's one of a few hundred people treated with deep brain stimulation, DBS, for depression.
Very, very simply, DBS, deep brain stimulation, is a pacemaker for the brain.
It is giving small amounts of current. We deliver it at 130 hertz, and it's on all the time.
Hollenbach says the effects were almost immediate.
So a cafe or a cool restaurant, like these things wouldn't even be on my radar with depression. They wouldn't even be possibilities.
She regularly sends brain data to researchers, logging onto a tablet and placing a remote above a pacemaker-type device in her chest.
Layers of data going from self-report, scales, to how you look, how you sound, how you move.
Hollenbach still takes medication for depression and needs ongoing care, but she's convinced.
If I hadn't had DBS, I'm pretty sure I would not be alive today.
Researchers hope DBS will soon be approved for millions of Americans with treatment-resistant depression. Now, there are some concerns about serious potential side effects that can include strokes and infections, but researchers say they're going to continue with the studies, hoping to make it safer for people who really need it. It can be a game changer.
Yes, it can. Stephanie, thank you. Yes, indeed.
With a rigorous travel schedule and the pressure of performing in a city like Philadelphia can take a toll on players and coaches as well. Dr. Deanna Nobliza helps Phillies players and coaches with their mental health during the season. She's now in her second season with the team, and Nobliza admits she worried that the stigma of mental health could get in the way, but she says she has been pleasantly surprised by the willingness of the team to embrace her initiatives and get help when needed.
A lot of care and attention being put to their physical health. But what I try to emphasize is that mental health is health. I like to think that actually in seeking help, there's a lot of bravery.
Dr. Nobliza says she also hopes her work is measured by those who come after her.
Thanks for watching this week's Health Watch. If you're enjoying the show, download our app, CBS Philadelphia, on your smart TV, Apple TV, Roku, or streaming device to catch us every weekend. And stay with us. There is much more to come here on CBS News Philadelphia.